This is the Emergency Medical Minute, sponsored by Mile High Ambulance.
Basically, with thyroid disease, you can have obviously low thyroid to elevated of thyroid hormone production. This patient came in with Graves' disease, and so she had altered mental status, tachycardia, reported elevated temperatures at home, was not febrile here. Her clinical picture when we got our labs was that she had an elevated T4 and a low TSH, and so that's consistent with the diagnosis of thyrotoxicosis. I guess that's the main thing I wanted to talk about was just the treatments for it, because there's 4 particular drugs that you want to give, and they also sort of have to go in a certain order. Do you guys know what they are? So there's so much like adrenergic stimulation from the excess of thyroid hormone production that the first drug that you give is propranolol. It just kind of helps suppress that adrenergic activity. After that, you want to decrease thyroid hormone synthesis. So there's a couple meds we use for that. There's PTU, which is propylthiouracil, and methimazole. They both inhibit conversion of thyroid hormone and help decrease its synthesis. Another one you can give, which decreases the release of it, is iodine, potassium iodine. That needs to be given about an hour after you give your inhibiting agent. So after you're giving PTU or methimazole, an hour later you can do the iodine. And then lastly, it's hydrocortisone. That helps decrease conversion as well. And also if there's a concurrent adrenal insufficiency, it helps treat that. So those are kind of the 4 meds to give for a patient with thyrotoxicosis and some of the clinical features of it.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.